Very good. So hi, everybody. I'm Andy Dwyer, University of Colorado Cancer School of Public Health and chair of the Colorado Cancer Coalition. I'm joining you from Cheyenne Wells, Colorado today, my hometown. So I was looking at the poll and it said, where are you located? So I decided to go with that Eastern flair. So for all of you in rural Colorado and Front Range and everywhere, thanks. I think we've got a ton of folks joining from throughout the state. So we are joined in for the winter meeting in terms of the Colorado Cancer Coalition and our work as a statewide org to really elevate all things cancer prevention control. And so super excited that that we're going to move forward, and in the nature of being very Zoom fantastic and in this virtual time, please rename yourself. So name, org, preferred pronouns. Turn on your camera, which Christy said, I think already that we've already gotten some big participation today. And if you can, go ahead and stay on and mute unless you're talking. So everyone mute yourself. And Christy, I don't know if there's a fun sort of audio with this gentleman speaking, so I don't want to detract from that. But anything else on the AV side of things, Christy?
Just if you're having technical issues today, please chat with Becky Seelig. She's going to help me with the tech support throughout the meeting. So that's it. There's no sound here, just the image.
Okay, I know. I was like, what is he saying? That looks very fun. So go ahead and rename yourself if you don't know how. Just go ahead and hit your camera or your video, and I think you right click and you can, at the bottom of that link, you can rename. So just go ahead and spend some time doing that. We have an action-packed agenda today, so we are going to get jamming. Our goals for today are understand what's happening broadly in terms of cancer policy for our 2020 legislative agenda. I think we have 4 or 5 folks who are sharing some great perspective. We're going to be doing some speed networking, so meet somebody new. I think that's randomly arranged, so we'll get a chance to network like we did in person, but virtual. It worked famously at the symposium. We're going to learn about the coalition priorities for 2021, task force priorities, and then sharing partner updates. So again, we're going to try to keep jamming and move forward really quickly today to make sure that this happens in a really efficient manner. Christy, anything else before we move forward? Okay. Who is the Colorado Cancer Coalition? So we are for anyone who's new, Christy, do we know how many newbies from our poll? Is there anyone that's first timer oncoming? Oh, 20% of the group, it's your first coalition meeting. So we're super excited about all of you joining in today. So we'll just take a quick step back to talk a little bit about who we are, and I'll have Christy. And I just want to give a shout out to Debbie Dyer, Dr. Dyer, who's joining us, who is our past chair, as well as Allie Bain from ACS, who's going to be coming in as our new chair. And just a reminder for everybody, as you're speaking and thinking through the work today, thinking about if there's a chance for leadership, building collaboration, the coalition is really a great way for you to be engaged. So we are a statewide, bipartisan, multidisciplinary coalition. We provide education, networking, best practice sharing, and partnership in terms of opportunities for those of you in working in oncology care and support. And again, that's across the continuum. We're committed to providing a neutral space for the dialogue and diverse perspectives to further improve cancer outcomes in Colorado. And in addition, we support the needs of Coloradans to prevent cancer, detect early detection, enhance quality of life, and for survivors, patients, as well as caregivers by disseminating education, resources, connecting patients and their caregivers, and opportunities to advocate for better cancer outcomes in Colorado. So huge shout out to everyone who's been involved in the mission drive, and then all of you who are really part of the coalition, which again, a great gathering today. Christy, anything else you want to share based on who we are as our brilliant executive director who's done phenomenal things with the coalition? Anything here specific?
No, I just want to again thank everybody for being here today. It's great to see new faces and lots of faces I recognize as well. We're only as strong as our members, and thank you for taking the time to be here today and engage in the conversation.
Great. And I do want to give also a shout out to organizations like CDPHE and Becky Seelig's leadership as well. So it takes a lot of volunteering, a lot of time, and dedicated resources as well from folks who are providing that support and infrastructure. So a huge thanks to our leaders at the health department and the Comp Cancer Unit and beyond. Okay, next slide. So Why engage in the CCC? So Christy, I'll have you take this slide, and then we'll go ahead and start moving into part of our additional work.
Yes. So there's so many different things that you can get out of the coalition, and there's a place for everyone. So there's lots of educational opportunities, lots of networking opportunities, access to experts, access to support for your patients. You can find a place where you fit and find a place where you can add your expertise. So I'd love to have a conversation with you if you're new about what makes the most sense, like which task force you're interested in or other committee work. So there's lots of ways to engage, and I just look forward to seeing you all throughout the year. So now I'd like to introduce Wayne with Grail. He's just going to give a few remarks about Grail, and thank you to Grail for supporting this meeting today.
Thank you, Christy. I really appreciate the introduction. Thank you to the Colorado Cancer Coalition for the important work you do to eliminate the burden of cancer in the Mile High State. Grail is honored to support that mission. As a young company, we're excited to be part of this exceptional community, and we're honored to be here today. Grail's mission is to detect cancer early, when it can be cured. The earlier that cancer is found, the higher the chance of successful treatment and survival. Yet too often, cancer goes undetected until it has progressed to an advanced stage. Using the most rigorous science, we're developing a blood-based early detection test to change the trajectory of cancer mortality. This technology, known as multi-cancer early detection, or MCED for short, has shown the ability to detect dozens of cancers with a single blood draw. By identifying cancers earlier, before they spread, MCED could be the innovative breakthrough that helps turn the tide on the war of cancer. MCED could also close racial and rural disparity gaps because of its simplicity. Once available, MCED could be administered in a primary care setting, making cancer screenings more accessible to all of us. Like those of you who are here today, we're inspired by the opportunity to reduce the burden of cancer on Coloradans and all Americans. We are proud to support the Colorado Cancer Coalition and look forward to working together. Thank you for all that you do in your fight against cancer. Christy, I'm turning it back over to you.
Great, thank you. I look forward to seeing how this technology progresses. Okay, so Debbie, you're up next. So we're gonna go to a lung cancer task force update and then switch gears to the rest of the agenda and then finish up the task force updates at the end. So Debbie, you're up.
Yes, thank you. And hello, everybody. I appreciate having a slot early in our agenda today because unfortunately I have to go off to another meeting at noon. It's a really good meeting because it's talking about vaccine distribution that we're going to be doing this weekend to our over 70-year-old patients here at National Jewish. So it's all good, but I'm sorry I have to leave at noon. But our lung cancer task force has been busy this year. And just as a little bit of background, of course, we would love to have other folks join our task force. We want to involve clinicians and researchers and public health folks and navigators and staff people within community health settings to join our lung cancer task force. It is, of course, the #1 cancer killer. And so we are working very hard to bring in all kinds of folks, stakeholders who may be interested in promoting the early detection through screening and also working on advanced treatments and patient survival, improving the survivorship of patients and really celebrating our patients. We have engaged a couple in the past year of patient advocates that have unfortunately had lung cancer, but are now active in our group, and we welcome any other patients who might want to be interested in joining us. Next slide. This year, one of our big events was in the fall, we held a symposium. We invited folks from around the state of Colorado, and it was very successful. We actually collaborated with the American College of Radiology, and they engaged some folks from outside of Colorado to participate in the symposium. So we had people from across the country, and it was an 8-week event that was very successful. We are planning to have another symposium next fall, and we're just beginning the preparations for that. So anybody that might be interested in working on the symposium, we target mostly lung cancer screening awareness, but we know that there are other important issues that we also need to address. So for example, radon awareness. And so this January, it being Radon Awareness Month, we held a webinar. The Lung Cancer Task Force hosted this, and we invited a wonderful speaker, Dr. Bill Field from the University of Iowa, to give us the webinar and educate us about radon. And leading up to that, we actually were in the process of forming a radon subcommittee within our task force, which we've already established, and we're inviting folks to join that from around Colorado. Of course, radon is a risk for lung cancer, and there's a lot we have to learn and do in that area. Colorado is particularly one of those states that's affected by radon. And then another big initiative is, since we, unlike the BRFIS data that can provide information on breast cancer screening uptake and colon cancer screening uptake, we don't have that question about lung cancer screening. Lung cancer screening is done by CT, and it is covered for high-risk individuals by Medicare, Medicaid, and commercial insurance, but our only way of getting the information about the uptake is through a query of the All-Payer Claims Database. So we've been working now with the All-Payer Claims Database folks now for about 3 to 4 years, and we're getting great information. We're seeing an uptake in an increased uptake in lung cancer screening, but we have more work to do, we know. So that's an important collaboration for us. It does cost us some money to get that report. So we're always looking for folks that either through industry or through some additional grants or scholarships that can help fund that effort. And we've had a lot of help from, of course, our partners at CDPHE in these efforts. So that's kind of my overall summary. I'm happy to take any questions and would love if anybody on the call is interested in joining our task force. We typically meet the third Tuesday of the month. Right now it's obviously virtual, and we do a call at 5:30 p.m. Mountain Time. Any questions?
I put in the chat the link to the recording and also the link to the Lung Cancer Task Force page. So I think in the interest of time, if people have questions, I'll have them email the Lung Cancer Task Force email.
All right, thank you.
Yes, thank you, because we have a jam-packed agenda today. And thank you for joining so you could give that update. So next up, we are going to get an update from the health department from Nikki Collins. So Nikki, if you want to go ahead and unmute yourself.
Sure. Hi, everyone. So Nikki Collins, as Christy mentioned, I'm with the department, and I am glad to be back with the coalition. It's been probably 5 or so years now, but I was a regular back in the day, and it's good to be back. I'm sort of taking over for some of the duties that Crystal Morwood used to be involved in. So if you're familiar with her, she has moved on to a different role, and so I'm stepping in to oversee some of our colorectal and comprehensive cancer programs now at the department. So with that, I'm going to share a couple of updates from a recent CCPD meeting, which is the Cancer, Cardiovascular, and Pulmonary Disease Grants Program. They are a key funder of cancer programs in the state. They funded a number of programs over the years, and there's a current 3-year grant cycle. There are currently 22 grantees that touch on those disease areas of the CCPD grants program. The current funding cycle will end at the end of June of 2021. For some specifics, there are 4 current cancer-focused grantees within CCPD. There are 2 HPV-related grants, one with Denver Health and one with the University of Colorado. There is the Colorado Cancer Screening Program with Andy Dwyer at the university. And there's also one with Boulder County Public Health to do radon, technical assistance and education. So it is of note that the CCPD and tobacco grants program, both of which are funded from Amendment 35, they made the decision to extend a subset of grantees for an additional 2 years, partly because of the impacts of COVID, uncertain revenue funding, a variety of grantee capacities that have been impacted this last year. And then also internally, we're in the process of revising our chronic disease state plan and the coalition, as you all know, are in the process of revising the current state cancer plan. And so to most ideally align the next CCPD funding round with these state plans, we need more time to most effectively create the plans to identify the most relevant priorities for the state. So the decision was made again to extend a subset of grantees for 2 years. Unfortunately, based on the revenue, there's not enough funding within CCPD to extend all of the grantees. So there were some decision-making processes that took place internally, and 16 grantees have been recommended to be extended for funding that will run from July of 2021 through the end of June 2023. And I want to share that there will be 2 cancer grantees that are getting extended. So that is the CU CCSP program and also Denver Health, their Alliance for HPV-Free Colorado. Unfortunately, right now, Boulder Public Health, the Radon Project and the CU HPV project are not getting recommended for extensions, but those programs will still be continuing through the end of June. So just want to make sure that everyone's clear that the work is continuing through the end of June, but come July, there will be some changes with who has CCPD funding. I also want to note that, well, I will also share that a total of 6 programs were not extended in addition to a training and technical assistance provider. So it was not just these 2 cancer grants that were not extended, for just sort of some broader context. It's also to note that the next round of applications for CCPD and tobacco will likely be released in the summer of 2022. So please keep that on your radar. And then those grants would start in July of 2024. So just for some high level updates as to kind of when new funding opportunities may present themselves. So I know that was a ton of information very quickly, that if people have a question or if we have time, I'm happy to take any.
Awesome. Thank you, Nikki. This is great. And I know that a requirement today is that you had plenty of caffeine so that you could speed talk to the best of your ability. And I think everyone has done amazingly. So again, a huge thanks to all the folks who are at the CCPD Review Committee, the volunteers. And just as a reminder, there are opportunities throughout the duration of different years throughout the time for volunteers to serve in these committees as subject matter experts and to help drive the vision and where the direction of the CCPD work is moving. So thank you a ton. Nikki and Christy, I think we are ready to go to our policy panel for today. Am I correct?
Yes, yep.
Okay, great. So as noted at the beginning of our agenda today, we're grateful that we have a group of dynamic presenters who are going to share the policy agenda in Colorado. We're going to get some great perspective based on Diana Protopapa is going to share some 2021 high-level session overview based on her work with us at the coalition. She's been a great resource and is going to share. We're also going to hear from Ellen Penrod in terms of the state of tobacco control in the report. Sarah Swan is going to share the Cancer Caucus overview. And then we'll hear from RJ Hours about the health equity focus in the direction of ACS CAN. I had an opportunity to talk to Bill Kantz this morning from the director of the federal leadership for ACS and their work. So that ACS health equity lens is fantastic, and excited that RJ is going to get to share that from our perspective in Colorado. And Christy's going to be able to share some of the work that's happening from the Screening and Cancer Fund based on some of the work that the coalition is moving in some of the call to action for coalition members. And we will have a bit of time for Q&A. So with that, Christy, in terms of run of show, did I get it correct? Are we good with Diana coming up first?
Yes, so just bear with me with the slides because we're changing it based on people's schedules. So I'll skip forward to Diana's, and Diana, you're up.
Good morning, everyone. It's a pleasure to be here. Andy, I've been called far worse, so no worries about that. I am Diana Protopapa. I'm a partner at Frontline Public Affairs. We are lobbyists, and we have about 27 clients, largely focusing on healthcare, public health, mental health, a little bit of education, and the like. So I wanted to talk, I've been asked to talk for a few minutes about the upcoming legislature. I just want to take you back for a moment, and I'm sure many of you probably are not looped into this because not many people follow state politics, but in December, the legislative leadership, both Democrats in the House and the Senate, made a decision to gavel in on I think it was January 11th. It's the second Wednesday of January. They are constitutionally required to gavel in every second January or Wednesday in January to only take up highly technical issues and for the minimum amount of time it takes to pass a bill, which is essentially 3 days. So they met for 3 days in early January, and they recessed again, and they are slated to begin again on February 16th. Depending on COVID rates. So haven't heard that they're going to extend that recess any longer, but we'll keep you posted if that happens. The legislature will be jam-packed with legislative proposals. One would think that with a pandemic, perhaps less bills would be introduced. Not so. They will have lots and lots of bills to introduce, and many of them substantive. Let me just touch base on a few healthcare related bills that may be of interest to you. One bill that could impact the populations that you all work with is the Prescription Drug Affordability Board. That is a board made up of experts knowledgeable about drug prices in the pharmaceutical industry. It would not include pharmaceutical industry representatives. There will be 5 representatives that sit on this affordability board. It will function like what we call a type 1 board. Think about the nursing board, the medical board, et cetera. And we'll have independence to create rules and make decisions based on creating what is called an upper payment limit for the most expensive drugs on the market for insurance companies and others who have to purchase drugs like an insurance company to pay for. So that upper payment limit, say it's $250. That's the most that an insurance company would have to pay a drug company to purchase those drugs for their clients. That bill is a priority of the Colorado Consumer Health Initiative, as well as the governor's office. And we expect that that will be a contentious battle at the Capitol because the drug companies obviously don't like it. So we'll keep you posted on that. The other bill that's a priority for the governor's office, as well as the Colorado Consumer Health Initiative, is something called the public option, which you may have all be a little bit familiar with. The public option is different than what was introduced last session. They did run a public option bill last session that had to be killed because of COVID and not enough time to take up such another contentious bill when we were in the throes of a pandemic when the legislature reconvened again last May. So the bill will have a two-step process. They're creating another, actually called the Colorado Health Insurance Option. The first process, it requires insurance companies to come up with ways to reduce premiums by 20% in 2020, I think it's 2023 it starts. If insurance companies meet that goal of reducing premiums by 20% for that health insurance option that must be offered wherever individual insurance plans are offered, then that continues. If insurance companies can't reduce premiums by 20%, the second part of the bill kicks in, which creates a quasi-governmental entity that would create the public insurance option. And much like Medicaid, not housed under healthcare policy and financing, but it would look like it is a quasi-governmental entity, and that insurance option would be offered to folks in Colorado that are interested in purchasing it. So stay tuned for that. That will be just as big as actually is going to be bigger than the Prescription Drug Affordability Board. Again, heavy focused on healthcare, education, the budget, and law enforcement again. I'm thinking that's it. And I can't think of anything else that you all might be interested in, but I'm happy to answer questions.
Okay, great, Diana. So I know Diana has to jet right after this. So if you have any questions, please go ahead and let them type them in the chat, or if you want to come off mute, we'll just give you a second as well. Again, we have a pretty tight agenda, but I know that Diana has some exciting stuff to share. So I'll just be quiet for a minute and see what comes up.
Diana, thanks for that update. Is there a resource that we can look at to see more about those bills, as well as how to reach out to you if we had questions?
Yes, I will forward the fact sheets to Christy for both the Prescription Drug Affordability Board and the health insurance option, and she will get that to you all.
Okay, great. Anybody else? All right, thanks a ton, Diana, for joining today, and appreciate all the support as always. So
Thank you.
great, we'll go ahead and transition to Ellen, who's going to be sharing, I believe, a website to share a little bit about the tobacco work. So good morning, Ellen, or I guess it's actually, oh yeah, it's still morning. I'm like, wait a minute, where are we at? Morning, afternoon. So Ellen, I'll turn it over to you. And I think you might be on mute.
There, I had to figure out how to unmute myself. Thank you for inviting me. Yes, so we're excited. Yesterday was the launch of our 19th annual State of Tobacco Control. And so you may have seen a little bit of this information on CBS 4 or some of the other news stations, but this is obviously one of our signature reports that we put out every year for the American Lung Association. And this is really policy focused, state by state grades on different areas to see how we're doing in helping ensure that states are making sure that their citizens stay healthy and off of tobacco. So you can access this at lung.org/SOTC, very easy, and you can select your state. So we'll select Colorado here. And you can see we have kind of a mixed bag here in Colorado with grades. So we'll go through each of them very quickly, one by one, so you can kind of understand where we're sitting at. So first grade that we get, unfortunately, for tobacco prevention cessation funding is an F. We are not funding to the level that is CDC recommended. Obviously, some of this will change as we see the results from Proposition EE and some of that backfill, but we need to be spending a lot more money on prevention and cessation. Smoke-free air, we are a B, and this is one of the parts that breaks my heart a little bit because we used to be an A in smoke-free air. We were one of the leaders in the nation in ensuring that any indoor area was smoke-free. Unfortunately, with the establishment of marijuana tasting rooms, we are no longer at an A, and so the American Lung Association is definitely still committed to ensuring that nobody has to inhale any kind of smoke anywhere if they're indoors. And so we would really like to see the exemption for these marijuana establishments and smoking to go away. And so we're working on that really on a municipality step-by-step level, and we would love to see that, of course, integrated into our overall smoke-free laws here in Colorado. Tobacco taxes. So this is actually good news. We used to be an F. We are now a D because our tobacco tax increased because of Proposition EE. And thank you probably to so many of you that are on this call today that helped us pass that tobacco tax. You will see this number going, this grade going up as that tax increases over the years. So we're very excited that we finally did pass that tobacco tax, and we are going from being at the bottom of the list nationwide with tobacco taxes. So congratulations and thank you. And this is exactly what advocating and working towards policy can do for us. Really proud point in Colorado, our access to cessation services. And you know, as people probably on this call know, quitting tobacco is really, really, really hard. And so the fact that we allow people to get coverage on their cessation services and that we have that covered is fantastic because people are going to need to try over and over and over again. So we have medications that are covered, counseling are covered, our state quit line, we have a great investment there, and it is part of our private insurance mandate. So excellent work, Colorado, on cessation services. And then finally, this is a new grade for the American Lung Association, which is flavored tobacco products. As you guys know, flavored tobacco products do addict kids very easily, and the flavors of mint and menthol have really impacted our communities of color disproportionately for a very, very long time. And so the American Lung Association is a big advocate of no flavored tobacco products. That includes mint and menthol, which often get left out of these kind of legislations to prohibit flavored tobacco products. And so right now we are at a grade of F because we have no state law or regulation on flavored tobacco products. We are looking right now, working municipality, city by city, county by county to get that changed. And hopefully, cross our fingers, we would love to see this change on a statewide level because obviously this is impacting people's lives and really does extend that experimental time with tobacco products a long time, because if you didn't like the mint flavor, maybe you'll like the creme brulee flavor, maybe you'll like the mango flavor. So very, very important to us to get this changed. So you can check out all of the other states if you're curious how other states that you work with are doing. And we look forward to changing these grades, but really great news overall for our state, especially around that tobacco tax.
Awesome. Ellen, let me ask you this just quickly as we transition with Sarah on deck. I think Sarah's doing a verbal, so we don't have slides, but just, and you might have said this at the beginning, how does Colorado rank overall, would you say, versus the rest of the nation, if you just had to give like a 10-second synopsis of where we are? Where are we?
Oh, that's a great question. And it really depends on area. I think we do really well. I mean, our smoke-free law has been in place for a very long time. Again, that exemption for marijuana tasting establishments was a little bit of a hit. We are in, unfortunately, very poor company with almost all other states around flavored tobacco products and such like that. So we have been making some great progress, and we should be proud of all the advocacy that we've done to move these needles.
Awesome, wonderful. Thank you so much. And of course, the coalition will be ready and on guard to help with additional initiatives moving forward. So thank you so much. And I will now move to Sarah Swan, who's going to give an overview from the Colorado Cancer Caucus. And a huge thanks to Sarah and her leadership with all of the folks that are really engaged in this work. So Sarah, I'll turn it over to you.
Thanks, Andy. I do not have slides, everyone, and actually this is nice because I can't even see myself talking. So, oh, that's fine. I could stay off the camera. Good afternoon, or I should say good morning, everyone. Yeah, just wanted to do a quick overview of the Cancer Caucus, and thanks, Christy, for inviting me to share. For those folks that don't know, the caucus at the state legislature has been running since 2015. I am sort of the unofficial organizer / staffer for the caucus. Those of you that may cover other states, every state legislature is a little bit different in terms of how they allow for caucuses to be formed and supported. And I think we're really lucky here in Colorado that we have a lot of flexibility in how the caucuses are set up. And it's really, a group of legislators that has a passion for an issue, and I think they move forward to form a caucus. So one of the nice things is that you don't have to have leadership to run a bill to actually form any kind of caucus. So the Colorado Cancer Caucus, I'll just go ahead and read the mission statement. It's the General Assembly's forum on cancer to develop and promote statewide public policies to bolster existing and new programs while supplementing or creating resources across the spectrum of cancer prevention, early detection, research, education, treatment, and survivorship in order to increase the quality of life for cancer patients and survivors. And this mission statement was actually crafted by the Cancer Caucus in 2015 when we first started meeting. So our current Cancer Caucus co-chairs, it's Representative Daphna Michaelson-Janae, Senator Janet Buckner, Senator Kevin Priola, Senator Dominic Moreno. Unfortunately, our wonderful Senator Nancy Todd was termed out. She was one of the original members. And then also the Lieutenant Governor Diane Primavera, who was one of the original founders of the caucus when she was House Health Chair back in 2015. The caucus really tries to meet once a month. I think, like everything else in 2020, that was a little bit more challenging. In a more normal year, we do meet at the state legislature. From time to time, we will go out in the field and meet at various geographic locations around the Front Range, but probably 95% of the time, the meeting is at lunchtime at the Capitol. In our pandemic year of 2020, we have moved to do some meetings over Zoom, and Christy actually has been really supportive in lending me her Zoom because I use Teams, and it's always a little bit more cumbersome to do things over Teams. So we will probably have a meeting in February. I'm working with the legislators now on dates and topics. I do think one of the things that other folks will probably talk about today that we would like to focus on for this year are conversations around health equity in the cancer space. But we're really open to different speakers and topics. I think over the years, I have pages and pages of the presentations and the things that have been discussed and covered. So it's everything from, understanding Colorado's cancer burden, skin cancer prevalence. We've had radon folks talk before. We've had presentations on CSU's Flint Animal Cancer Center, presentations on various new research methods that are occurring in Colorado. It really runs the gamut. So if you do, work in the community or in the business sector and you have a speaker that you think would be appropriate, I'm all ears. You can email me at sarah.swan@bms.com and we can set up a time to chat because I'm always looking to bring new ideas and new speakers to the members. From time to time, the co-chairs of the caucus and actually other legislators do spearhead legislation that moves forward. And a good example of that would be last year, there was House Bill 1232, which was around health equity in Medicaid and clinical trials. So that's something, just as an example, that's moved forward from conversations that really started, with a presentation several years ago at the caucus. So again, just want to encourage folks to participate. The actual distribution list I keep, and there's probably 150 different stakeholders on that list. So again, we'd love to have you, and thanks, Christy, for popping up my email there in the chat box. If anyone has any questions, I'm happy to answer them, or we can go forward to the next presenter.
All right. And I think we'll have a bit of Q&A at the end. So Sarah, thanks a ton. And I just want to say that I think even at the federal level, there's different types of clinical trial legislation and access. And the fact that Sarah and team and many others really looked at an equitable lens to move that ahead in Colorado, I think speaks volumes to the leadership that we have at the policy level. And thanks, Sarah, so much for really convening that group at the legislature and keeping cancer on the front. So, and I would also attest that Sarah's really great about reaching out. And if you have topics and people who think can speak to specific disease areas, it would be great. I know even in the area of lymphedema and management of survivorship, there's been some great topics covered. So as much as it's impacting our constituents and our survivors, this is the group to really help bring, because this is where change is made with policy. So again, a huge thanks. And I think pivoting to the health equity component, RJ is going to talk a bit about ACS's movement in the health equity lens and thinking about what equitable approaches to cancer prevention and control look like. So RJ, I'll turn it over to you.
Thanks, Andy, and good morning, everybody. Happy 2021. It's good to see everybody out there on the screen this morning. As ACS and ACS CAN began to look at some of the challenges now in this time of COVID, and even before we got into this, we knew that we needed to begin to look at things a little more broadly. What are some of the root causes of chronic disease, especially cancer, through the cancer lens? What are the root causes of it being such a problem to deal with? And we began to look at the issue of health equity, and we're partnering now with the Robert Wood Johnson Foundation to try and address this in the work we do, in the community outreach that we do, that people like Allie do through ACS, and in our advocacy work at ACS CAN. So we've come up with some pretty established parameters that we want to work within, and I wanted to share those with you today as we look at our framework for advocacy and policy for 2021. For ACS and ACS CAN, health equity means everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. It's not the same as equality. Equality is providing everyone with the same tools and resources. Rather, equity is providing tools and resources based on the needs that allow everyone the opportunity to be as healthy as possible. And within the advocacy scope or parameter, ACS CAN's fighting to achieve health equity, the just and fair opportunity for everyone to prevent, find, and treat and survive cancer, regardless of how much money you have, the color of your skin, your sexual orientation, your gender identity, or any disability status, or where you live. That's why we're supportive of establishing a screenable cancer fund, for instance, this year, and want to work really hard to that goal, to ensure that uninsured Coloradans have the same opportunities to prevent, detect, and treat cancer. Cancer is a disease that affects everyone, but it doesn't affect everyone equally. Health disparities adversely affect groups of people who have systematically experienced greater social or economic obstacles to their health based on their racial or ethnic group, religion, socioeconomic status, gender, age, or mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, geographic location, or other characteristics historically linked to discrimination or exclusion. So we want to work together with everybody to begin to overcome these barriers, re-emphasizing much of the work that we already do, and then finding new methods or new program opportunities to go after some of these challenges. You know, health is driven by more than inherited characteristics like genes. It really is more of can be more of a symptom of where we grew up or where we live, access to doctors early in life, nutrition, better or not so good. And we can't let these social determinants of health, such as financial stability and hardship, or unexpected medical bills, paying out of pocket for preventive health services, or access to healthy foods, food insecurity, or transportation and mobility, continue to contribute to these health disparities. Social determinants cut across all the work being done at ACS and ACS CAN, and significantly influence a person's ability to prevent, detect, treat, and survive cancer, and also dictate a person's opportunity and ability to make healthy choices, thus greatly impacting their cancer experience. I want to really get to the point here in Colorado. You know, we've made some great progress in many areas of trying to reduce disparities and achieving better health equity already. You know, back in 2014, we embarked on expanded healthcare coverage through the Affordable Care Act, and we expanded Medicaid. Great things to begin to provide better health opportunities and outcomes to our neighbors here in Colorado. We have worked hard, we and our partners have worked very hard to reduce tobacco use in disparate populations and really statewide. We've seen, as was mentioned earlier in the work on tobacco, we have made progress, but we need to continue to redouble our efforts in those areas. And I think we all know where opportunities still lie for work there. We most recently made some terrific progress in providing better equity in enabling people on Medicaid in our state to more easily enroll in clinical trial programs. And that's so important because we've got such great research facilities and opportunities here in Colorado. So those are some areas where we've made progress, need to continue working there to make sure that continues to be the norm and not the exception. But in one particular area, and this is where you'll see, I think, many of our partners working this year, we want to expand greater access to cancer prevention, early detection, and treatment, regardless of race, ethnicity, or economic status, in the area of cancer screenings. And that's why we want to embark on this Screenable Cancer Fund to more equitably provide those life-saving screenings and treatments to people who continue to be uninsured. And there are, tens and tens of thousands of them. And we can't let them fall through the cracks. So we'll be committed to that work this year as we have in other years, but particularly with that focus on screening and treatment opportunities. I think I've said quite a bit already about the whole equity program. We'll be talking about this more throughout the year. We'll have our annual policy forum coming up in July, where we'll really have some breakout discussions on the various facets of health equity and just where all of that goes within our work. And I'm happy to take any questions now or later on. Christy, thank you very much for the opportunity to speak to this issue this morning.
Yeah, thank you, RJ. And sorry for the slides. I have a new mouse that has a mind of its own and likes to advance and do things. So sorry about that.
Not at all.
RJ, I just want to pick up on a point that you mentioned, and I think Ian Kahn from our colorectal task force made a comment is, you know, we talk about equity and they're talking about a lot of good work in this area, but I think it's important to remember, you know, that there's a lot of great programs. I think you've mentioned the breast and cervical program, the colorectal program. There's a lot of work that happens, I think even clinical trials access, where there's been work even in the BNC program for 20 and 30 years around equity and access. And in a lot of ways, there's a lot of good support that needs to continue for this work and to really continue to drive. And there's definitely needing to look through different lens and thinking different communities and how do we really elevate the work. But I think there's also some great infrastructure that has been built throughout the state for us to continue this great work. And somebody on the phone and through this Zoom call today are really have been in the trenches working through this area. Great to hear there's some excitement and some renewed energy with these sort of initiatives. But RJ, I think your point around, you know, let's continue with this momentum with some of the great things that we can build upon, I think is really core and pivotal at this moment.
Thank you.
Totally great. Okay.
Go ahead.
Heidi
Morgan with Susan G. Komen, and I agree with your point exactly. I mean, you look at the great work at the breast and cervical cancer screening program, and I know that there's been a lot of ideas floated for looking at a Screenable Cancers Fund. At this point, sort of targeting the, you know, the women's wellness connection. And I think that's really the wrong path if we're really trying to, you know, continue the great work that we're doing for women of color who are predominantly impacted, and the fact that this program is designed really to target primarily or in large part under and uninsured women. And so, you know, I'd hate to see us, you know, rob Peter to pay Paul. You know, we don't want to hinder the ability of people to go out and get screened for breast cancer so that we can, you know, boost colorectal cancer screenings. I think as a group, we probably all want to see more people screen on the colorectal side. And I know that the current program, the colorectal program, is, you know, targeted at people who do have access to Medicaid. And so, you know, I really want to make sure that as we look at solutions for this, and this is something that Susan G. Komen has proposed to the Cancer Coalition, you know, there are other opportunities rather than targeting existing funding for breast and cervical cancer programs to look at long-term sustainable funding so that we can have a long-term solution to not just colorectal screenings, which I know that's sort of what's targeted this year, given that's where the grant funding was for your initial policy proposal. But looking really at a full screenable cancer program that wouldn't dip into the women's wellness connection. So just wanted to offer that, and we're super happy to provide, you know, additional input and suggestions, because, you know, there are so many different options out there, and we want to make sure that we help create the best solution long term for all screenable cancers, not just colorectal, not just breast. And we're happy to provide suggestions and thoughts and ideas.
Okay, thank you, Heidi. So let's go ahead and transition, and I think that's a nice segue, unless we have any other comments. I don't know if anyone is coming up in the chat right now. Okay, great, because I know we have time for Q&A at the end as well, so great. So thanks so much, RJ, for the presentation and talking about where we're going and the comments moving ahead so far. So Christy, I'm going to turn it over to you to talk a little bit about some of the legislative work that the coalition has embarked upon. And I think there's a little bit of work that happened last year that was curtailed because of COVID, as well as some of the things that are coming, and then also this session. So Christy, I'll turn it over to you.
Yes, thank you, Andy. So last year, the coalition really jumped headfirst again into policy with trying to get the colorectal cancer screening age moved from 50 to 45, and that ended up stalling because of COVID and all of that. And then in the meantime, the USPSTF came out with some draft recommendations to change those guidelines. So now that lift is taken off of our legislative load, and we can reprioritize and look at where we really need to be going. So RJ mentioned the Screenable Cancers Fund. Heidi mentioned trying to find solutions for a comprehensive screening program going forward. And so we didn't get to share some of the details yet, but what we want to share with you today is what we're looking for a long-term solution. So cancer is the leading cause of death in Colorado. Most states, cancer is not the leading cause of death. We're unique in that. 23 people, based on the latest numbers from ACS, 23 people die a day of cancer in Colorado. So, we exist to make that number go down to zero. So we're looking to create a comprehensive statewide screening services program that would give flexibility to CDPHE to use data to really focus efforts on where cancer screening is needing most and what populations really need that most. So it goes back to a lot of what RJ said around health equity and really prioritizing where this money needs to go. And all that said, and this isn't highlighted here, since the state has had a very successful breast and cervical cancer screening program, within the legislation, there is money earmarked that makes sure that the number of women screened won't dip below what the average has been for the past 5 years. So what we have currently right now is we have the Sustainable Breast and Cervical Cancer Screening Program that gets money from federal and state dollars. And then we do currently have a colorectal cancer screening program, but as Nikki was mentioning earlier, it's funded by a competitive grants program, so it's not guaranteed. And right now it's set to go away in 2023. So the time is now to start creating these long-term comprehensive solutions that can really focus on comprehensive whole body care. Also, cancer doesn't discriminate against men and women. So we need a comprehensive program that can focus on both men and women. I'm gonna pause there. Andy, RJ, do you want to pipe in here?
Christy, I think that the point around that, and I think Nikki had shared earlier, that really the time limitation for statewide initiatives that have been from this sort of fleeting grant funding, it is an expiration date, and some of the initiatives that are happening through CCPD really do live from grant cycle to grant cycle without sustainable funding per se. And so I think on some level, CCPD and funding through the state have helped really elevate the work, but looking for strategies for radon, for some of the HPV work, even population-based screening approaches and others. I think holistically, we have to probably think a little bit about sustainability beyond. So I think it's a really valid point in terms of the whole cancer continuum and what we're funding moving ahead. And I think that you stated that as well as Nikki. And so I think it's something we have to really consider moving ahead for our initiatives.
And I completely agree with Andy. I mean, just looking within the scope of the health equity notion, those are two items that really fit within that qualification. I mean, the whole radon issue, that's really a kind of a statewide issue. People live with that because of their geography, and on the HPV factor, obviously having access to vaccinations for HPV is so important, no matter who you are, where you live. So yeah, sustainability of these things has to be something that we really focus on.
Right. And I do
Absolutely.
think to that point, also thinking about possible synergies with messaging and efficiencies through programs and that we're talking about from that equity lens and moving forward is definitely critical.
Hi, my name's Carlin Calloway. I don't know if you can hear me. I'm the co-chair of the Survivorship and Palliative Care Task Force with Janice Hansen. And I just want to thank everybody for coming together with this important bill. I think it is absolutely crucial that we work for breast, cervical, colorectal, melanoma, lung, head and neck, all sorts of screening for cancers, especially in the setting of COVID. We know that people are not getting their routine screenings, and we know that there are many challenges ahead of us. So wherever we can come together and combine our synergies and our efforts with other task force, with other people throughout the state to help those affected by cancer.
Great. Thank you, Carlin, too.
If I might jump in, I mean, Carlin's absolutely right. We need to be ready for the pent up demand for cancer screenings that we're going to see if we can get to the point in the next 6 months to a year where the COVID risk hopefully subsides and people begin to come back to their traditional schedules for screenings and get back on track with that.
Hi, this is Lauren.
Hi. Oh, go ahead, Lauren.
Oh, this is Lauren Marquette with Susan G. Komen. And, listening to all of the folks talk about, comprehensive cancer health, we certainly understand. But, our extreme concern is dipping into the fund for breast and cervical cancer. And, we want to make sure that looking at a sustainable way to do this, but not dipping into that fund, and so we had talked about, I know we had mentioned license plates and other ways to create funding for this, but that is our big concern here.
And it's our goal not to dip into existing monies. We're looking to augment screening opportunities and the breast and cervical cancer screening program that's existed for years is so successful and a great model. We would be very remiss to allow any diminishment of that program to occur, and that's no one's intent here.
And Christy, do you want to, because I think you have a few more slides, is that correct, to move forward? Or are you good at this point?
The next slide I have is for the Colorado Cancer Fund.
Okay, perfect. So I think that we'll have more opportunities, I guess, Christy, moving ahead. And I'm sorry, I didn't know if you had more to share in terms of looking at an opportunity. There'll be, Kurt, do you want to talk a little bit about where this initiative is right now in next steps?
Yes. So the bill is still being drafted. So it's not quite, the draft is not quite final. And then once it is final, it will be submitted for reading. And so we would really like to collect, let me jump ahead a few slides. We would really like to collect support for our fact sheet that we'll be sending around soon. Stories from providers, navigators, patients, caregivers, writing op-eds, sharing testimony as it starts to go into Senate committees and House committees, and then sharing about it on social media as well.
Okay, so it sounds like with at least what's being drafted so far, we'll be ready as well as fact sheets and information for people to learn more. But in terms of bringing it to a primer and information, thanks for everyone for the comments and perspective, and we'll have more detail to share about the initiative moving forward. And I want to just actually, sorry, Christy.
Real quick, I wanted to just mention one other thing, because I know that the goal that you have is not to move into the funding that's for the screening, but the navigation and outreach to women, for those, to get them to the screenings, to ensure that they have the support to make that happen. That's critical to actually getting these people screened. And so I just want to make sure folks understand that that's where I think some of this fund is looking to go into. And it's just not, we wouldn't do that to other cancer funds out there. And we would hope that, as a cancer partner, that you would not do that to the breast and cervical cancer screening fund. So I know that the intention is good. We all support getting more screenings out there, but we have real concerns with where this is going, and the fact that we've continuously expressed our concern and provided alternatives. And it seems to be falling a bit on deaf ears. And we really hope that you will consider these concerns a little bit more strongly as a cancer board.
Heidi, thank you for sharing that. And I'm sorry that you feel like it's falling on deaf ears. I want to address one thing about the navigation and the other, where the rest of the money goes. The navigators and the clinics that the breast and cervical work with also work with the colorectal cancer screening program. So these clinics and navigators are already navigating people in for colorectal cancer as well. But it's two separate complete processes where they have to report on breast and cervical to one entity and colorectal to another entity. So they're spending time reporting to one and reporting to the other, and training for one and training for the other. So a combination of integrating them would save these navigators and clinics time, and then allow more people to come in the door for cancer screenings. And then just in terms to address like the license plate idea, I think to run a license plate bill, grow it to an amount that would actually add to enough money to have a screening program, like you're still going to have duplicate programs. We're trying to get rid of the duplication of programs so that it can be really, really comprehensive care.
And unfortunately, not all of the navigators are working in the same space for breast cancer and colorectal. And I think that's important to recognize.
So Heidi, thanks for your comments. And I think that as Christy, as the bill starts to progress further, we have through the coalition support, the sponsors have heard, I think, from several different organizations about the opportunities and what could be perceived threats as well, and have decided to move forward. And I think the legislation is moving ahead. And I think that there will have a dedicated time to talk through I think some of the things that Christy has shared upon, as well as Heidi, some of the specifics to have detail. But again, that legislation is being drafted to have further discussion about possibilities for a truly preventable screening across disease types to move forward around the most pervasive and lethal cancers. So thank you for the comments. I think this is, I know today there was top level discussion, getting a chance to share some perspective, but we'll have more opportunity, I think, to delve into some of these further. And it looks like needing that discussion and being responsible with that would be super helpful. Christy, I know that you still had a discussion around the Cancer Fund, which I think is actually exceptionally important as well too. So, and I want to be cognizant, I know that several have shared perspective, but I want to also make sure that if we have any questions or comments from anyone who hasn't shared so far, that we get you in the chat, as well as if you want to come off mute as well, that would be great. So Christy, we'll go ahead and have you finish out for the Cancer Fund, allow a little more time, and then we will progress to the rest of the agenda.
All right, so we'll have one other bill this session. Those of you that don't know, the Colorado Cancer Coalition is listed on the voluntary contribution form of your state taxes as the Colorado Cancer Fund. And that is, that's the money that we use to grant back out into the community to implement cancer plan activities and quality of life activities for survivors and things like that. So as organizations are put on the tax form, they're generally put on with an end date. And so this next tax season is our last time on there. So we're working on another bill to make sure we can remain on the tax form to keep that money coming in, because that money is critical for cancer plan implementation, and also, you know, creating and getting programs out into the community. So look for that one too. And if you're a former Cancer Fund grantee, I'll be reaching out to you to just get some more information from you. And if we have to provide testimony, see if you're willing to provide testimony at those hearings. So I talked a little bit about ways you can engage. Again, we're always looking for stories, and specifically looking for some around you know, like physician champions that work in the cancer screening space, as well as if people have had trouble accessing a colonoscopy. So stay tuned for more Ask for Stories. But in the interest of time, I think we will move on to our speed networking so that you all can get a little break from us just talking at you, and you can meet someone new. So I'm gonna stop my share. So I'm going to pop you into automatic breakout rooms. You don't have to do anything. But when you please don't leave. We still have lots of stuff to go over when we come back, of lots of ways to engage, and you'll hear from the task forces. But you're going to automatically be popped into a breakout room. So say hello, your name, your organization, your title, and in less than 30 seconds, what you do. I'll try to give you all little prompts to trade so that we can make sure we get through everyone, but go have fun in the breakout rooms. And then please do come back, because we've got lots more to cover after that. So it should take you automatically to the room, and just look for the little prompts that say like, switch to the next person. So we'll do this for about 5 minutes and then we'll come back. I know that's never enough time. Maybe we'll have time for one more at the end, but no, everyone's not back yet. Did everybody at least get to introduce themselves very quickly? Good, good. Did you meet somebody new? Awesome. It gave 2 minutes, so everybody should be appearing back in here shortly. Alrighty, people are starting to come back. So we'll give it just a second to make sure everybody comes back. I know it's really short. Maybe we'll do one more at the end if we have time. But it looks like everybody's here. And it looks like there's always drop off whenever you go to that. There's a risk, but hopefully you all enjoyed the breakout rooms.
I think what's confusing sometimes when it says leave room, you think you're going back versus leaving the whole session. At least for me, that was a confusing prompt.
Okay.
You know, in terms of leave room versus just let you bring us back.
I'll have to look into that to see how I can provide better direction or do something different on Zoom's end in the future. Thank you.
Yeah, I was able to click leave meeting though, and it took me back to the main room, so it did work.
Good, good. I did that once and I ended up getting dropped off completely. So.
Gotta love technology.
Yes, I know. You just never quite know what's going to happen. It keeps us humble.
All righty, so I'm gonna very quickly go through just some other coalition updates that a lot of the links are on the agenda that was emailed out to you, but I just wanna highlight them here so that you all know. So I mentioned the Colorado Cancer Fund. It has funded some really neat things over the past few years, including survivor retreats, survivor events in Spanish. This is a survivor long day event out in Durango that is a picture of. Also some exercise and cancer research, and it's funded Project Angel Heart for meals and some financial assistance. It's a competitive grant program, so it ebbs and flows every year on the types of things it does flow, but it's always looking at priorities across the state. So please do spread the word about the Colorado Cancer Fund on line 12 on your state tax form. You'll start to see a lot of social media from us about that. And then hopefully most of you have received an email from somebody asking you to share your I am and I will statement. I'm hoping to do a huge social media blitz on World Cancer Day, sharing all of your wonderful commitments to cancer causes. So we have Representative Yadira Caraveo, who says, I'm Representative Yadira Caraveo, and I will fight for equitable screening and prevention services for all Coloradans. Jamie Stutz is a researcher at the University of Colorado Cancer Center, and he's been greatly involved in our lung cancer task force and providing a lot of insight there. So we have his statement, and then Ian is one of our wonderful colorectal cancer task force chairs. And so I've received some statements, but I would love to get, if everybody on this call would send in their I am and I will statement, I would love it to just share about how strong the cancer advocates are in Colorado and how committed they are to the cause. So there's more information on the agenda where you can submit your photo and submit your statement. Also on February 4th, we're hosting a webinar with the Alliance and also the Colorado Cancer Screening Program on the COVID-19 vaccine and considerations for cancer patients and other patients with chronic disease. So please join us for that. We'll have Dr. Chris Liu and Dr. Mark Ernest who will be addressing those topics. And that's also linked so you can find out how to register. The next thing, those of you that have been around for a while, you've probably seen a few cancer plan public comment periods, and one will be coming soon. It's not ready for prime time yet, but Becky's been working really hard with task forces and with the Cancer Plan Revision Committee to edit the cancer plan for the 2021 to 2025 version. So there's a form here where you can sign up to be notified when it's ready for public comment. So you can read through, see if there's anything glaring that we've missed, and provide your feedback on what the new cancer plan will look like. And Brandy, I see you have your hand up.
Yeah, I just had a question. Is there any research or information about the COVID vaccine and how if it works or not for people who are currently going through chemo?
Excellent question that I cannot answer. Maybe someone on this call can, or maybe Dr. Liu could answer it on the 4th.
Hey, Christy, if it's okay, I'll just share. We just had one of our gyn-oncologists do a webinar on this. And she said anybody in treatment needs to work with their doctor specifically, that if you are at the height of treatment, you may want to wait, because when your system is suppressed, it won't react as much to the vaccine. And so it could be like not getting it. It won't hurt you, but it won't protect you. So anybody in treatment needs to be in conversation with their doctor.
Okay, so they don't really know if it's going to work or not, depending on where you're at in your treatment.
You would need to wait. Like if you are in treatment, you might wait until right before your next infusion, so your system has recuperated as much as possible. You wouldn't want to get it right after you were just infused, for example.
Okay, thank you.
Sure.
Thank you.
I think reiterating that, talking to your clinician about it, because all of the even with immunotherapies and certain types of reactions, there's something very different for everyone. So I think Patrice, that's a really good point.
Great. Anything else while I'm paused right here?
Christy, I think the one thing that had come up, and I know one of the things in this situation, I think we're going to talk also a little bit about the levels in terms of how the state is doing a rollout specifically. So I know Dr. Liu and Ernest will talk specifically about the medical implications for cancer as well as chronic disease components. I think they'll be able to talk on some level about what the rollout looks like in Colorado, but there's some of that even our partners at the state health department talked about that are still in process. So I think just a reminder that this is probably as real time and up to date as the moment that we share it, but the coalition will continue to try to give real time updates as well.
Great, thank you. So I think I pretty much finished the public comments. If you'd like to be notified, I'll also be sending that to our newsletter list, but that will be coming soon. And then it's the time of year where our leadership will be transitioning on. So Debbie Dyer, who has been amazing for the past 3 years, and even before when she was the lung cancer task force chair, she will be moving out of the past chair role, and Andy will move into the past chair role, and Allie will be the chair. So we will have an opening for vice chair. So if you are interested in learning more about what that looks like and helping guide the coalition direction for the next 3 years, I'd love to have a conversation with you about what that looks like. Okay. I know we just stopped for questions, but any questions? I did put lots of information on the agenda around the stories we're looking for, the webinars that are coming up. All the links can be found in the agenda for you to look at later. But any questions before we move on to task force updates? Janice asked a question about, has the governor been invited to the webinar? We have not, but we can certainly send it to his staff and the lieutenant governor's staff and see if they are interested.
And Christy, to that point, I think it's important to note that even on behalf of the leadership and the coalition, you have shared the information about really prioritizing cancer patients for vaccines and really advocating on behalf. And I know the coalition has taken an active stance moving that forward. So really appreciate those who really stepped out. And I know, Janice, you were one of the folks who spoke about that. And I think following federal partners as well as on a national or as on a state level, we've really been trying to move that ahead to talk about people who are medically vulnerable and what does that mean from an equitable standpoint. So I just want to say that's been something that we put forward for sure.
Yes, and I'm even hearing from some of the patients I speak with that they are writing to the governor about that as well. So your patient populations would be a great source to tell their story and make that known to the governor.
Great, thank you. Okay, so we couldn't do any of the work that we do without our wonderful task forces. So now I want to let them have the spotlight and share all about the great work that their task forces are doing and how you can engage with their task forces to keep, eliminating the burden of cancer in Colorado. So first up, we have colorectal. So Meg, are you still here with us? Yes.
Yeah, I'm still here.
All right, you're up.
All right. Thank you for giving us a few minutes to highlight the work that we've been doing. This has been a wonderful meeting thus far. So the Colorectal Cancer Task Force has been around for many, many years, and I co-chair the task force with my partner Ian Kahn, who could not be here today. We're a statewide group that does a lot of peer sharing, engagement, and learning collaborative in order to provide action and support to colorectal cancer initiatives across the state. We have a robust partnership
both at the national level and the local level between clinics, nonprofits, pharmaceutical companies, and we really wouldn't be able to work without our wonderful task force members. Next slide. The Colorectal Cancer Task Force, we meet once a month on the second Thursday at 7:30 in the morning. And we have 3 smaller working groups that really do a lot of the driving towards meeting not only the Colorectal Cancer Task Force action plans, but meeting the goals put forth within the cancer plan. The 3 task force, I think, have been pretty similar within the last couple of years, but have evolved to reach a broader audience, including Colorectal Cancer Awareness Month. We have worked with many different partnerships regarding lighting Colorado blue. In the past, we've lit the city and county buildings blue. We work with corporate offices to bring lighting their buildings blue to highlight colorectal cancer awareness. We have a robust employer education work group that is working to develop standard lunch and learns or standard reporting for any employers that is looking to highlight benefits for colorectal cancer screening to their employees. We also have a wonderful provider support and education work group that is doing a lot of work regarding and supporting clinics regarding cancer screening rates and peer sharing. And I think that might be it.
Great, thank you. Next up, we have HPV. So Jenny and Heather.
Hey everybody, I'm Jenny and I'm the co-chair of the HPV task force with Heather. I know she's on the call. She did have to step away, so I was just giving a
Jenny,
second.
I just heard I was on a call. A patient just called me back. So Jenny, if you don't mind taking it away, just because I have to just finish and I'll be right back. Okay.
No worries. So our HPV task force is working on growing our membership and engagement. We are not only focused on bringing public health professionals, clinicians, I think somebody had mentioned research and wanting to bring them into their task force as well. And we're looking at lots of different professions, dental professionals, medical professionals, pharmacists, anybody who can help engage in local community education and awareness building activities and vaccine promotion and the prevention of HPV related diseases. Next slide, please. Our task force meets typically on the first Thursday of the month from 9 to 10. And we recently participated in the January peer sharing call. January is National Cervical Cancer Awareness. And we also had a task force member host their annual fundraising event during the month of January as well. I think something that's on the horizon that I have a big passion for is HPV related oral and pharyngeal cancers. And I work in the oral health unit at the Colorado Department of Public Health and Environment. And so in advance notice, we're hoping to do something in April for Oral Cancer Awareness Month. Thanks.
Great, thank you, Jenny and Heather. I've been trying to pop the links in here. I'm going to go through and add colorectal, but the HPV link is in there if you want to learn more about what they're working on and connect with the HPV task force. So next up, we have the Skin Cancer Task Force, which I will be providing that update today because we get med students as the co-chairs of this one, and they often have busy schedules. So their next meeting is on February 2nd at 3 p.m. And they've focused a lot, which was very hard in 2020, around getting out into the community to provide sun safety messaging, give out free sunscreen samples, show people the skin damage from sun. And they had to pivot a lot in the digital world to figure out what they were going to be working on. So they focused a lot on like videos and trying to think of other people they could bring to the table to their task force. And when the world gets back to normal, they're looking to work a lot with the Sun Bus to get back out to the community, to high traffic events, and really, really get that sun safety messaging out there, as well as other cancer screening messaging. And it's always on their radar as well, some tanning bed legislation. So we'll pop the skin cancer link into the chat, but if you're interested in learning more about that one, you can check out their webpage as well. Next up is Janice and Carlin with the Survivorship and Palliative Care Task Force.
Hi, everybody. We're very happy to tell you about our task force and what we do. And my name is Janice Hansen, and I am one of the co-chairs with Carlin, my partner in crime. We make a great team, so I'm really excited that we both get to help lead the efforts of this task force. Our task force really is cross-cutting for any type of cancer, and it is focused on quality of life. In fact, it formerly was known as the Quality of Life Task Force. And part of that is the experience of survivorship, of support, of palliative care, and how we all work together to provide services and resources that enhance a cancer survivor and their families' quality of life in dealing with cancer. So we have a wonderful collaborative of both the survivors and professionals and people who provide programs that support patients in their cancer journey. And so it's a wonderful collective, quite diverse with regard to how we continue to promote and educate each other and support the work that we do. We have an important goal that we want to make sure that we reach and represent all corners of the state. As we know, a lot of work tends to be done in the Denver area, but we really want to highlight what's happening across the state and be able to support efforts and create partnerships, collaborations, and efficiencies in the work that we do. Next slide. And Carlin, feel free to jump in as well. We're wonderful as a tag team, and so there may be some things I forget that we should add. Is there anything more you want to add about the first part, Carlin?
I would like to say that there are many amazing nonprofit organizations that are members of our task force. So this is by no means an exclusive list, but Nancy with Epic and Vicki with Sites and Insights, feel free to put your website in the chat box so that the people attending today know of all the great work that you're doing. I will say that during the networking session that we just did, I found a speaker for our July meeting.
Awesome, awesome.
And I roped her into it. I twisted her arm.
That's cool. That's great. And
I want to say one last thing, and then I'll
sure.
be quiet and let you finish. But we are in the process of coordinating a webinar for the 13th of April. That's a Tuesday at noon, talking about disparities in cancer care. We have a very engaging speaker. She's a physician at Denver Health. And I encourage you to all save Tuesday, April 13th at noon for our next webinar. That's all I have, Janice. Thank you.
That's awesome. Feel free to jump in. Those are all also really important points to make, that in the effort of networking and supporting each other's work, we provide education at each of our meetings at some level about a topic of shared interest. So our meeting is held on the fourth Tuesday of every other month. We just had a meeting this Tuesday and a wonderful presentation to learn about all the work that's being done in Southwest Colorado by a coalition of volunteers in that area. And we have done provided different topics as well. And some of them are listed here. So with this education and collaboration, we continue to focus on how we can partner with other groups, such as the the Advanced Care Planning Work Group, in promoting Healthcare Decisions Day coming up April 16th, and then continue to reach out to any other organization that we think that would be helpful in our efforts to support survivorship and the understanding of and the integration of palliative care services. So in March of 2021, Jen Kluss is going to be doing a wonderful presentation on palliative care in Colorado. So we hope that you'll feel that that's something that speaks to you and that you'll be able to join us. We have a large membership, and so it's really fun when we get on Zoom and we actually get to see each other and connect in that way. And then previous topics, for example, that are recorded and are on our page for the Colorado Cancer Coalition Task Force website was on intersection of homelessness and cancer. We had someone that spoke to us about what the state of that concern is and how we can promote and support cancer care among this population that often gets overlooked and is very challenging for all of us to serve. And then in September, which is Ovarian Cancer Awareness Month, we also had a wonderful presentation with regard to the impact and the resources available for ovarian cancer. So we hope you'll join us. You'll keep in touch. Carlin does a great job in helping send out messages and updates along with Christy about what we're doing throughout the month. And we certainly invite you to offer ideas about topics we can cover or work that we can do together. Carlin, do you have anything else that I might have missed that you want to add?
Thank you.
We're good to go. All right, well, keep in touch with us. And I think we'll have our website posted as well. There, I see it there. Very good. You're on it, Christy. Thanks.
Great, Janice and Carlin, thank you. And thank you to all my task force chairs and everybody that participates on the task forces. Thank you so much for engaging in the coalition work. Like I said at the beginning, we're only as strong as our members. So we need all of you to engage and share your expertise and keep moving the needle so that we can help more Coloradans touched by cancer. So now it is time for partner updates. So if you have an event, a new program, a new funding opportunity that you would like to share, I'm gonna actually go ahead and stop my share so that we can see everybody. You can put it in gallery view if you wanna be able to see everyone. Does anybody have, just feel free to come off mute and share your updates. This is how, if you remember the ones in person, you'd walk up to the front and share your update with everyone, and then the next person would go. So you can either raise your hand, just come off mute and start talking.
Christy, hi, this is Andy. I just want to say that we're really excited that we're going to be continuing the colon screening work as we get ready to move forward, where we're looking for more sustainable work to continue the statewide approach. But we have some exciting things, and that March 2nd, we're having our State of the State. We're going to talk about the new screening recommendations. ACS has done a beautiful job of helping lead the way in terms of looking at the rates from 50 to 45, took a strong stance, and USPSTF has that within guideline. We'll be talking about the latest in screening approaches, what's happening in our state, and how can we really advance the work. And March 2nd, we're excited to have that. And Denver Health has a new GI doc who is a national leader who's coming off the chief of GI at Denver Health, and he's going to be joining us. So I think he'll be a great contribution to our work. And he's already shared that he'd like to be very engaged in the coalition and our CRC task force and thinking about prevention moving forward. So we're really excited about that. And Christy, I don't know if we've shared that in our updates yet, but the coalition and CCSP are going to be working on that together. So March 2nd, but I'm hoping that will be the continuation of some additional programming with our CRC task force moving ahead.
Great, yeah, I will be sure to include those dates and registration links in future emails.
Christy, if I might, I'm Tommy Stewart. I'm one of the co-facilitators for the Thyroid Cancer Survivor group here in Colorado. And I just wanted to let everybody know that we have virtual monthly meetings, And I need to work with Christy to get us listed on their support groups and the coalition. But we have monthly meetings and we're excited this year. All our meetings are virtual. Third Monday of the month at 7 o'clock, sponsored by the UC Health, or excuse me, the School of Medicine there at UC Health. And we are fortunate this year to have a number of medical experts that will be presenting at our meetings and also taking questions and general discussion regarding not only thyroid cancer, but other thyroid issues like hypothyroidism, Graves' disease, Hashimoto disease, all things associated with the thyroid. And just as a side note, thyroid is probably the number 2 or 3 cancer found in women today.
This is Brandy. So I have an update as well. So exciting news. We hired a new executive chef. Finally, his name is Brett Newman. 2020 was rough for everybody, but it was especially rough for us this year. We lost our executive chef unexpectedly, went on vacation and passed away. So we finally got a new chef on staff, so that's exciting. And we are doing a fundraiser kind of meet and greet where you can cook together with our chef, and it's a virtual cooking demonstration where we would sell a kit and then you can use that kit to cook with him. So I will post that information in the chat if anybody's interested. And then our annual Dining Out for Life event is also still planned for April. We're not asking restaurants to participate, but we're encouraging people to go out and eat at the restaurants and then still doing some fundraising around that. So just check out our website. Thank you.
Hi, go ahead, Nancy.
Oh, sorry. I put a couple of things in the chat. This is Nancy Farrow with Epic Experience. We've gone completely virtual with the rest of the world, but we've had some exciting programs. Our virtual camps are a 3-day, hour-and-a-half each day program, and we just held our first all men's program. It was actually our largest one to date. So I think that tells us men like to chat with one another. So that was an exciting program to start. And then we have an exercise class. It's all free, everything we do for caregivers, survivors. We've had people in the hospital call in for some of those. And we will be switching our Beyond Cancer series to a podcast. And what that series is discussions with cancer survivors, what it's really like to have cancer, to hopefully help those recently diagnosed. And we've had psychologists, physicians, social workers defining what those roles are. So it's all in an effort to support adult cancer survivors. So it doesn't matter when somebody was diagnosed, we just want to help people. Thank you.
Okay. Hi, I'm Vicki with Sights and Insights, and we do mindful therapeutic art programs. And I just wanted to let everybody know that we do have we've got about 3 new different ones, but one of them that I thought a lot of people might be interested in is what I call the clinical caregivers class. So, normally all of our workshops and programs, classes, they're all free to any cancer patient, survivor, and caregiver. Well, the same goes true now for the clinical caregivers who are out there on the front lines and helping all of our cancer patients and the survivors and their families. So that's quite a burden that you're all taking on. So these classes are free to anyone who would like to sign up. They're on Saturdays from 1 to 3. Just go onto our website, register for it, and then we'll get the supplies to you and then have some fun. And it's there to help with burnout, compassion fatigue, which is now ranking pretty high up there in the mental health for the caregivers. So if you have any questions, go to our website or contact me. Thanks, everyone.
Janice is showing one of her creations from the class. All right, are there any other updates? Going once. Going twice. Okay, I'm going to pull back up one last slide. So our next meeting will be on April 22nd, and last year we did a session on implicit bias in healthcare, and we had people take the implicit association test, and we had a really good discussion around implicit bias. And so to continue on those series, we're going to dive a little bit deeper into what microaggressions are and how they play out in healthcare. And the webinar that Carlin mentioned would be a great precursor to attend on April 13th. And then come on the 22nd for a meeting similar to this. It'll be a little bit more workshop-y than as much, this one was a lot of talking at you. So there'll be some more discussion in that one. And then we'll have task force updates as well. And then maybe some celebrations of legislation, we'll see. So I hope to see you all again on the 22nd, if not many times before that, at task force meetings and other coalition webinars and everything. Andy, do you have any final thoughts, or Allie? Doesn't look like it.
Yeah. Thanks, everybody. I mean, this has been a great meeting with a ton of information, and it's always so great to hear from all the different organizations and partners. So thanks.
Thank you, everyone. You can have five minutes back in your day to get ready for your next Zoom, but